Welcome to my weeks 30 through 32 update of living with Ramsay Hunt syndrome. It's now been 7 months. This is a longer update. I wanted to capture some medical visits that happened during this 3 week period, bridging off of the last update where I talked about meeting with my ear, nose, throat doctor. So I had a hearing test, had an MRI, also had my second facial therapy test. Let's talk about the hearing test. Okay, the biggest thing is I did see some improvement in mid frequency ranges. They do a tone test where they play a sound. You'll see that my recognition went up a little bit. But according to my audiologist, it needs to be a little bit higher before a hearing aid would work. Plus, I have low range and high range frequencies that I'm still not hearing very well. Also exciting was there's this thing where they would put words in there. They'd say the word, whatever, hamburger, French fries, and I would repeat the word. When I first tested this back in May, which was about 2 months in, I had a 0% word recognition. This time I had 40% word recognition. So while I'm still functionally deaf, there is some level of improvement. Now, the reason I was doing this was to see what the status of hearing was as we are considering a cochlear implant. I want to thank those who reached out to me and gave me some connections with people with cochlear implants. I'm still not at a stage where I have to decide, but it's quite possible that I will. I think the week after I had my hearing test, I went for my next facial therapy update. There was a great insight. My facial therapist works with people with nerve disorders, of which I am one of those. One of the issues I've been having is greater dizziness or lack of balance. Nothing that's significantly impairing me, but it is annoying. My facial therapist said this is most likely the nerve coming back online, resulting in the inner ear sending a signal and the brain having a struggle deciding what to do with that signal. I guess this is positive news and goes in line with the improved hearing I'm getting. Not sure if I'm going to get much, but I guess a little bit of dizziness means the nerve is coming back online. One of the exercises my therapist gave me to work on that, I'll show you right now, is to shake my head back and forth until I get kind of dizzy and then to let it settle. That's a little bit unnerving, but supposedly it's to help recalibrate the brain. So I do that every now and then. She told me I should expect a good year or more before things really start to baseline normalize. 7 months in, so I've got a ways to go. Some of the exercises we did, as you've probably seen in previous videos, I feel like I'm improving. This is my favorite thing, the little facial massager, mini massager. I am supposed to use it around different parts of the face while I'm trying to move, or I just use it in general. Try and close my eye. There's a muscle around the eye that's circular in nature. Try and help loosen it up. Use it down different areas of the muscles. This is the easiest therapy I can do because it's one of those therapies that feels good. So I'm supposed to keep doing that twice a day. Other thing, I'm supposed to pinch the nerves and twist. I don't know what this is supposed to do, but it feels good as well. Here's a funny one. I'm supposed to take the knife and make my lips disappear. It's kind of hard. One of the weirdest ones, I'm not going to repeat it here, but I'll show you a picture, is taping coins and trying to lift them up with my cheek. So these are some odd exercises, but it does seem to be making some progress. Let's do a palsy check. So I'm going to try and lift the eyebrows. Get a little bit of movement. You can see a little bit of movement there. Close the eyes. This is being pretty successful. See if we can puff the cheeks. I can do it if I can pinch it with my hand. Smile. Okay, I'm going to cheat and so if I raise this eyelid, it will twitch this part of the mouth muscle. Could never whistle, but I definitely can't flare the nostrils. I'm feeling a little stiff right now. I haven't loosened up the face in a couple hours. Baby steps. I am finding that I can go longer stints without my moisture chamber with my eye, less time needing to put eye drops in. I still wear the moisture chamber a lot, but it's going pretty well. Last update is I went and got an MRI. Again, my doctor wanted to scan and see what progress was being made on the inner part of my ear. And you can see here is the reading of my MRI. Good luck trying to interpret that. So I used ChatGPT. This is what it said. This MRI report is saying that your brain looks normal, but there are inflammatory changes in part of your right inner ear and facial nerve areas. So it looks like there's still indications of some inflammation. Guess that's just part of the territory. The tinnitus is still very strong in my right ear. While I do feel like there's some improvement in hearing, and the audiologist proved that as well, the ringing has not gone away. And I don't know if it's ever going to go away. It is pretty annoying, but not impacting my mental well being. So I got all these tests, and now I'm just waiting for my doctor to get back to me, and we'll see what next steps are. It's the doldrums of recovery. I'm working essentially full time now, about 40 hours a week. I have worked more than that previously. Owning a few businesses, it's hard not to work a lot of time, but it's really hard to get more than 40 hours a week, and it's pretty exhausting. Getting up in the mornings is still very difficult. Just baseline tired all the time. I feel like I'm in the slog of a long recovery, and I don't know when it's going to get over. It's a little bit challenging to have this never ending healing. I'm a little tired, a little bit frustrated. I mean, I'm grateful, but it is hard. I was thinking about it. Like, I see a lot of people that really struggle with Ramsay Hunt and obviously other things, but I'm more acutely tuned into Ramsay Hunt with some of the communities online that I'm a part of. And I think about the purpose of life. And on a spiritual basis, I believe life is about growth and learning. And my mind went to the book of Job. If you haven't read Job, Job was a fairly wealthy guy, had a big family, lots of land, lots of cattle and animals, big house. And there was a test between the devil and God. Said, hey, let's see how, Job's a good guy, but he's got it easy. Let's see how he does when it's not so easy. All his kids got killed. All of his animals were killed. His house burned down. He's pretty much left impoverished and defeated. And one of the first things he said is, the Lord gave and the Lord hath taken away. Blessed be the name of the Lord. Well, I've been given good health, and that really great health has been taken. I wouldn't say my health is terrible, but it's a far cry from where I was. Eventually, Job got everything back. Much of the book of Job is him being tested, lamenting, friends questioning why he was afflicted with those things. And I don't know. Good people get hard times, bad people get hard times. We all get hard times. That's part of life. And sometimes it's just hard. But what do? You just have to go forward. I wouldn't say I'm discouraged. I'm a little frustrated. But what I've found is patience and the frustrations go away. It's very helpful to have forward momentum. I know for some people, they never recover from serious ailments. And so there's a recalibration you have to do and try and get the most out of what you can. But I'm hanging in there. You hang in there too. If you like this video, like it, ask my question in the comments, share it, and I'll see you on the next one.